I think if somebody is told if they're too big for surgery or their BMI is too high to be a safe candidate for surgery, I think that first of all, we need to make sure that they've given you a reasonable representation of not only what can be done for you, but what your concerns are initially in order to be able to say that. So, as I've said before, just because you have a high BMI doesn't mean you're not a good candidate for surgery. It really depends on what you're looking to achieve. That's one, but primarily your medical condition is. Do you have any medical conditions that are potentially going to create a safety issue for you? So I don't think that just having said you have a high BMI and you can't have surgery, I think that's misleading. I think that a lot of women that I've seen over my career of almost 25 years, they like their size. They like the body that they're in. Just a few little touch-ups, a few little areas taken off here and put there or whatever to change just the way they look. So there really isn't a good determination as to whether or not somebody becomes a candidate or whether or not they're not a candidate because of their high BMI. But very simply stated, if you're not healthy, you may not be a good candidate if you have a higher BMI. And obviously, being overweight or being plus size may contribute to some comorbid medical conditions.